I did my OBGYN residency in St. Louis at WashU. And actually what brought me here was my interest in clinical research. As a pre-doctoral student, I did a summer research program here at WashU. And from there, I honestly just fell in love, and I felt really inspired to use my clinical research to try to improve patient outcomes. Oncology is one of the most humbling fields I think I could ever imagine myself to be in. When I was a medical student, there's a lot of learning that goes on of how to have good bedside manners. And there's a lot of education that goes into how to motivate patients to take a foot in the right direction and to lead a better life for themselves. But when I sat in front of my first oncology patient in G1 Oncology, I felt that all the inspiration that I was trying to pour into my patient counseling, it was just that breath of fresh air and the motivation and inspiration coming from my patient. So much that I'm not sure many people know, but when we become a physician, we have a white coat ceremony. And that patient came to my white coat ceremony because my family couldn't be there. She brought her 2 young kids and her family. So when I first see a new patient, the first thing that I try to establish up front is trust. It is a privilege to serve my patients, but I feel like I'm uniquely positioned because not only as a surgical oncologist am I involved in the treatment planning from a surgery standpoint, but as a G1 oncologist, we also are uniquely trained in administering chemotherapy. So I am very grateful to have that longitudinal care with my patients where I might not be necessarily the first one that diagnoses them, but I oftentimes am the one that's disclosing a diagnosis of cancer to my patients and their families. So I really try to put as much honesty on the table for my patients to understand exactly what steps we're taking. That means sometimes trusting their lives in my hands as a surgeon. But then the unique thing about G1 Oncology is that we have a multidisciplinary tumor board. And this is one of the hallmarks and one of those deep down inside feelings that I know I'm giving my patients the best care, because at this tumor board, we have the experts at the table, and not just one physician, but a multidisciplinary board of many physicians who bring a lot of different perspectives. So we have G1 oncologists, radiation oncologists, and oftentimes we have our GYN pathologists that are reviewing all of these cases, and we come up with a consensual recommendation. Siteman Cancer Center recruits from all over the country. We are recruiting the best physicians and oncologists, ancillary staff, researchers, all dedicated to the same mission. And I think when the institution is invested in this global commitment to improve patient outcomes, and they're building an environment where, as an oncologist, I'm excited to come to work. I'm excited to build collaborations, and I'm here for the right reasons. And I think when all of my colleagues have that same mentality, it just elevates Siteman to a different level because of the people. It's about the people that make the institution. It's not a name. And I think it's very transparent that when you come to our cancer center, you feel the warmth because they want to be at Siteman. And they want to be joining hands with people that have the same mentality, the same mindset to help patients improve their outcomes.